Beauty seekers, according to the Cleveland Clinic, up to 90% of women have cellulite. Fit women, thin women. It has nothing to do with your weight. We've been told it was salt. I was told that back in the day, and I cut salt out of my diet, or sugar, or not enough squats. We've rubbed on creams, wrapped ourselves. I've wrapped myself, and even paid for an injection that left some women with purple bruises that wouldn't fade. And still, the dimples never left. Today, a national cellulite expert visits our Beauty Seek community and teaches us 4 things. What cellulite actually is, why nothing really has worked to get rid of cellulite, at least until now, a new technology that is banishing cellulite at its source, and how she builds a custom body sculpting plan for a smoother, tighter body. Stay with us. She'll reveal that at the end.
The real root cause of those dimples, and I like to even kind of use my hands for this. So if you can see our video, we've got fibrous bands or fibrosepti that live under our skin. That's part of our connective tissue, right? And underneath the skin, we've got these fibrous bands that are literally pulling the skin down and tethering it down to the muscle below. So cellulite is caused by those fibrous bands. If we don't do something to actually eliminate or cut those bands, then we'll always have the cellulite. So no matter how much you squat, how much you work out, like you mentioned, I've got super fit women that still have cellulite. If we don't get rid of those bands, then we'll always have the dimples. And I'm here to tell you, luckily, it has nothing to do with things you have done, and we do finally have a solution.
I'm so excited. Sarah Viebrock is a registered nurse who specializes in aesthetics at Austin Plastic Surgeon in Texas. She's a national trainer and speaks on cellulite treatment, which means she teaches other providers how to do cellulite elimination work. Sarah, welcome to Beauty Seek.
Thank you so much for having me and speaking on one of my favorite topics. I'm so excited to be here.
I am too, because I need to know. Before we get into the science, I was told that salt causes cellulite. So seriously, I cut it out of my food for years. Can you tell me some of the most unfounded reasons for cellulite that you've heard from your patients?
Absolutely. Cellulite is something that drives us women crazy. And I think I've heard it all, but it all results in we think it's our own fault, right? The number one thing that I hear is I assume I'm too fat, right? I've got too much fat in my body, whether that's from salt causing water retention, I'm not working out enough, it's my genetics, so we all assume that it's something that has to do with me. And I know we're going to get down to the science, so I won't give you the real answer yet, but that is the root of it. All of us assume that it's us.
On this journey for years. I'll tell you some of the fun things that I've done. Let's clear this up once and for all. I did a little research before because I think I just really never believed, whatever reason we were being given, throughout my life. And then even when I was hearing the fibrous bands, I was like, oh, that just can't be a real thing. But in a 2020 review published in Dermatologic Surgery, cellulite is driven by those bands of connective tissue, just like you say, like not how much fat you have. So do the women who come to you really understand that cellulite isn't really a fat problem?
So good question. It kind of depends on if they found me through my social media. Hopefully they've been educated that it has nothing to do with them. And that's why I try to speak on this, all over social and everywhere I can. But of course, if they haven't and they don't understand, then yeah, they're looking for any sort of solution. And that's part of the problem is maybe they've tried something in the past. And I know we're going to talk a little bit about that. And that has kind of eliminated their trust in things that will work, right? Because they weren't treating the root cause. But we've got to just, go after it at its source. So if they're not treating the root cause, they're never going to get the outcome that they're looking for.
I'll tell you one thing that I did many times is put on this very thin suit and then had this kind of like vacuum roller suctioned all over my body.
Yeah, I've heard of that. I've heard of women doing this like board brushing, like all sorts of things that And unfortunately, they tell you to come back again and again. And, it's typically this really long series of treatments. And that's because all that you're really doing with treatments like that is creating inflammation, which maybe is going to temporarily hide your cellulite because everything's swollen, right? But then, as you'll see, very quickly, it comes right back because they did nothing to eliminate those tight fibrous bands. I like to call them bad bands, right? Because in our anatomy, we've got structural support bands or structural support connective tissue all throughout your butt and thighs. That's important. That's holding your skin up, right? So, the beauty of a true cellulite treatment that is done well is we are only treating those tight bands that are creating the dimples, and we're leaving everything else around them alone. So, you remain with that structural support that you need, and we only get rid of the bands causing those indentions, if that makes sense.
It totally makes sense, and especially makes sense when we see the video of you performing the procedure. That's when I finally became a believer, and I was like, "Oh my gosh, there's hope."
Right. When you see it, it makes perfect sense. You know what I
It
mean?
does. It does.
Mhm.
So, and most people, really, women don't know. And according to a review in Dermatologic, and that septi, they're called septi bands. Is that correct?
Mhm. Septi, yeah. Yep.
Septi, thank you. So those are those connected bands. Here's the way I think of it. They run straight up and down, almost like fence posts to me, and the skin's on top. So the fat pushes through those gaps. And that's mostly in women, but the men are crisscrossed. And I think I did hear this before, and I thought, well, that's baloney. But now I think I'm more of a believer. And that's why 90% of cellulite is in women.
It's true. Yeah, I would say out of my patients, I see very, very few men. And we know that, like you said, from many studies. And you're right. Most of us assume that it's just these little vertical bands. And now that we have actual images of what cellulite looks like, we understand it really is kind of this big fibrous web. And that's why, some things haven't worked in the past because we assumed it was just like, we could just snap a few quick bands and be done, but you really do have to be very selective, treat that whole web underneath each dimple while leaving everything else alone. But you're right, it's this web where the fat can basically poke through, right? Because the fibrous bands are pulling the skin down and create that dimpled cobblestone appearance that we love to hate as women.
I know. I know. Yes. My son would not let me. I kept referring to them as my dimples. And he's like, Mom, just, it's cellulite, man. So Cleveland Clinic reported that cellulite often first appears or gets worse during hormonal shifts or during puberty or pregnancy or menopause. When you're treating women, how much of that hormonal picture affects how you treat her?
Yeah, that's a really good question. And that is something that I discuss with the patients. With hormonal shifts, we do also see shifts in fat percentage in our body, right? We know this like as we go through puberty or menopause, we tend to accumulate fat in different areas. It doesn't matter kind of where you're at in that hormonal shift, because if we can treat the root cause, then it shouldn't really matter as far as your hormones go.
Okay, great. And thank you so much for just taking the blame off women, because really there's nothing genuinely that we can do about eliminating cellulite except for now with this new treatment that you're going to tell us about. Um, I know when I've lost a little bit of weight, the cellulite seems to reduce in appearance a bit. How much do you think cellulite is actually within a woman's control? A little bit through diet and exercise.
Yeah, good question. And that's kind of what that's was kind of a great little prelude because just what we were discussing. If the fat quantity goes down, which obviously if you lose weight, then sure, maybe it will look a little bit less deep. And that's just literally because when you gain or lose weight, your fat cells literally shrink or grow, right? You're not necessarily changing the number of fat cells. So, losing weight, diet and exercise, squatting, all of that is not going to get rid of the bands. You will still have cellulite in the same spots. Now, say you gain, again, like I said, a very large amount of weight, then your dimples might look deeper. But losing weight is not going to get rid of them. But we all know if we're at our, healthy, fit selves, then you might feel better, but you're still going to have those tight bands that are creating that indention. If you've had it for a long time, you squatting and losing 15, 20 pounds is definitely not going to get rid of it.
Okay, gotcha. That makes sense. And thank you. You took cellulite, something, obviously 90% of women have, and so many of us have blamed ourselves for it. And you showed us that it's really never our fault. It's not about salt or
Right.
willpower.
Right, exactly. Yeah, that's my favorite thing about it. We're all super women, unfortunately, in general, can be super self conscious. And when we're specifically talking about our butt or our thighs, or maybe the way we feel in our clothes when we're wearing something form fitting, or even our shorts, maybe you're not trying to get in a tiny bikini. You just want to wear regular shorts without feeling self conscious, right? So if I'm able to do something that can improve a woman's confidence, then it is my absolute favorite thing. So this has become one of my favorite treatments by far.
Great. I'm so excited to get to it. Beauty seekers, here's what to remember about cellulite. According to the Cleveland Clinic, it affects up to 90% of women, including fit and thin women. So it's not your fault, and it was never about salt. It's caused by bands of connective tissue under the skin, not simply by fat, which is exactly why creams and wraps and squats have never fixed it. Beauty seekers, if you want honest, evidence based answers about treatments like cellulite straight from experts like Sarah Viebrock, subscribe to Beauty Seek. Every subscriber helps us bring interviews with expert practitioners like Nurse Sarah directly to you. There was an actual FDA approved injectable called, I think it's called QWO.
Quo. Yep.
Quo. According to Dermatology Times, it was approved in 2020, and it used an enzyme, as I understand, to dissolve the bands that are
Mhm.
responsible, as we know now, for cellulite. And it was pulled from the market after leaving many women with severe, long-lasting bruising. And I almost got it. I was talking to a clinician and saying, "Hey, I want it on my thighs," and she said, "No, it's not approved for the thighs." I'm like, "Come on, you can do it on my thighs." But I'm so happy because I went back to my other clinic and one of the injectionists there did it, and she had a big, huge purple bruise that we're told will never go away.
Yeah, so I can actually speak pretty personally to this. This is something that we offered back when it first came out because, again, we do a lot of body treatments, definitely, especially treating the butt and thighs. So I actually have received Quo personally, and it's something that we offered at the practice. We were super excited about it, in theory, and of course, it was FDA approved. That the thought behind it is the enzyme is going to attack that specific type of fibrous band and help to dissolve it. But the problem is it also attacked, the areas surrounding the vessels, which created some leaking, AKA huge bruising. We're talking insane black and blue, so dark. And it's super unfortunate that it didn't work because it was very convenient, a few quick pokes, easy procedure. And the very unfortunate thing is I actually did see some women with good results. We saw some good results, but definitely not everyone. It wasn't as reliable. And like you said, some ended up with super severe bruising, which did typically go away with time, but sometimes it took some extra treatments to get rid of. So I'm thankful that we have some better solutions now for sure.
Sarah, you train other providers on cellulite all over the country, which means you've watched treatment after treatment come and go. Tell me about a patient who came to you, they tried everything, spent real money, and then still had the dimples. What did that feel like for her?
It can be super defeating. As we know, cellulite is something that affects our confidence, and we can really get down on ourselves about it. I had a patient that specifically came. She traveled. She drove several hours. Luckily, was within driving distance. Came in really just wanting to treat her cellulite, but for her, she had to be in her job actually required her to be in a tiny bikini pretty regularly. Her and her husband did some boat racing. She needed to be feeling super confident, super fit. She is someone who is in the gym every day, looks fantastic, but had some of that very traditional central buttock cellulite that drove her crazy. You could see it through her clothes. So we together came up with a treatment plan that involved a couple different things and resulted in a super optimum, beautiful outcome, 100% non-surgically. And she looked fantastic. She felt great. So it's all about that confidence that they end up with. But of course, the before and after is great too.
Oh, good. I'm happy for her. That's fantastic, especially if you're bopping around in a bikini.
Right? I know.
Let's start with the shelves full of products. According to the Cleveland Clinic, no cream, scrub, or wrap can actually get rid of cellulite. On a scale of 1 to 10, not very much to quite a bit. How much money do you think the average woman you see has spent on products that were never going to work?
I think quite a bit. I mean, typically at least hundreds and sometimes even into the thousands if they've tried those, wood wrapping, scraping treatments or cupping or something where you have to go back time and time again. But I know a lot of us, even myself included, before I got into this, have purchased things in the middle of the night while you're scrolling Instagram or Facebook and you fall for some ad with some fake before and after telling you that this is what's going to finally fix your cellulite. So I think most of us have probably done that in the past. So it honestly can result in quite a bit of unnecessary spend.
Yeah. I did wraps. Oh my gosh. It was so hot. And then, what's the tool? Ultrasound. Then they kind of rubbed an
Hmm.
ultrasound over me, and I was
Yep.
losing weight at the time. So I think I thought it worked, but I don't think
Hmm.
it did.
Yeah. 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 As I've mentioned before, sometimes it will create like a little bit of temporary inflammation, enough for them to be like, see, it looks great. And then within a few days to a few weeks, all of the cellulite is back because we didn't treat the root cause.
Mm, been there numerous times.
You're not alone, but sometimes it took some extra treatments to get rid of. So I'm thankful that we have some better solutions now for sure. Women
Times.
have been burned in the past, whether they tried Quo, whether they tried the lotions and potions and creams that they've ordered off Facebook, whether they tried, you know, like you said, wraps, ultrasound treatments, something like that. So it really is taking a while to win back their trust and explain why those things didn't work. The beauty of, I think, today's world in aesthetics is that we do understand the anatomy of the buttock so much better than we used to in the past. And once you can actually create this visual for women of what that fibrous anatomy looks like underneath the skin and explain how we can actually get rid of the bands, why certain treatments work better than others, then it's pretty easy to wrap your head around, but you need to see it and visualize it. So we're getting there. I can see everybody kind of, obviously my treatments are growing every day. So we're getting that trust back. We're creating some really optimum outcomes, but it's taken some work, of thankfully people like you helping to educate women all over the world on why things haven't worked in the past and why we've got a good solution now.
Great. Well, I'm so excited. Let's talk about it. We know there are many false ways that just don't work to get rid of cellulite, but now there's a real proven way. Can you tell our Beauty Seek community what it is?
Absolutely. So, my number one favorite way to treat cellulite is using a wand called Ovally. So, Ovally is one of the first and only FDA approved treatments to get rid of your cellulite fibrous bands in a one time procedure in the office. So, at Austin Plastic Surgeon, we do Ovally procedures awake in office. They can be added on to surgery too, but most of the time, if they're coming in just for cellulite treatments, it's a quick awake in office procedure. Now, I know the word procedure can sound scary, right? But if you've tried lots of other things to treat your cellulite that never worked before, then you are typically willing to try anything to get a long lasting solution or a long lasting outcome. The way it works is we do injectable numbing to flood the whole area where you've got cellulite. So think about this. When you're standing, you can see your cellulite, right? When you lay down, you really can't, right? Where, gravity is what's pulling on the skin and pulling on those actual bands, right? And creating that indention. So the first step is going to be walking you through the treatment. I'm going to mark out all your cellulite dimples while you're standing. You and I would go over the treatment or procedure together in front of the mirror to make sure we didn't miss anything, make sure that we're treating exactly what you want. And then once we've got that marked, we're going to flood that whole area with some injectable numbing. That injectable tumescent fluid is what it's called, is going to help block your pain nerves and it's going to help get some of the blood out of the area. So it's surprising, but bruising with Ovally is actually substantially less than what we saw with something like Quo, even though we're actually using a wand to go up under the skin and release those bands. Please come find me on Instagram. I have tons of videos. Sarah injects Austin. But we're going to make a tiny little opening in the crease of the booty, right? In that fold that we already have. So it hides really well. Less than a centimeter, less than the width of my pinky nail is what I always say. And now that you're good and numb, you're just going to feel tugging, pulling, and pressure. We go through that tiny little opening. We use the wand, which has a hook at the end. Until I'm ready to use the hook, it's put away, right? So you deploy the hook, pull back, catch the bands. Now I can recreate your dimples by pulling on those fibrous bands before I cut anything. And that's the beauty of Ovally, is it's selective, right? So we're going to use this little hook, catch the bands, pull back. I'm using our markings that we made while you were standing as my guide, right? And then it also has a little bitty light where I can see through the skin. So I know exactly where I'm working. If I'm catching bands within the markings, then I'm going to deploy the little blade, go ahead, pull through and cut that band for good. Once we treat it, it should be gone for good. Now, there's never just one fibrous band underneath each cellulite dimple. There's a whole web of them underneath each dimple. So we'll go through right to left, release that whole dimple. And then this is the best part, is the verification. So I'll use that same hook to slide through under the skin, make sure that now I can slide through like butter. I'm not catching any more bands. It's super satisfying, honestly. And that's how I know you're going to get a really good outcome, because I'm not catching any more bands underneath those markings while you were standing. And the beauty of this is I'm leaving everything else alone. Nothing's automatic. Everything is controlled by me. So we know that we're leaving that structural support around your cellulite there. We're just getting rid of the bad bands, creating those indentions so that the skin can smooth back out.
Okay. So I'm going to go back to my fence post, holding up my four fingers here. So,
Love it.
so the wand
Mhm.
comes in. It's almost like a
Mhm.
latch hook, maybe in my mind, where it just kind of grabs it and just just
Yeah, that's a good way. Yeah, absolutely. And that's the thing. So it's literally just like a little wand at first, right? Because the hook and everything hides within the wand. So
okay.
tiny, like it looks like a kind of like a needle, but it's not, right? It's a wand, the blunt tip, no needle. We deploy the hook when we want to, catch the bands, make sure we're where we want to release. If we are, we pull through and release. And then we use that same little hook to make sure everything's nice and smooth. And then we move on.
Love that. Okay, how long have you been doing this? Like, what do we know about longevity of this? Will they grow back? So many questions.
Yeah, we've been doing Ovally since it was released, which has been, I want to say, almost 4 years now. It's been quite a while. And in aesthetics, I'm sure you know this, we can't say anything is permanent, right? Legally, you can only say something lasts as long as it has been FDA approved. But when I see patients years out from their treatment, the beauty is we do not see that cellulite coming back. Now, one thing that's super important, and I know we're going to get into it, is I can't stop you from aging. So that skin has to be maintained. One of the things that I see all the time is people confuse loose skin with cellulite. So if you want to maintain that nice smooth booty, you are going to need to do some skin tightening over time, because as we age, of course, you're going to see some sagging to the skin, but you will not see that deep dimple from that fibrous band come back. So yes, long lasting treatment. That's kind of the best way I can describe it. Through with a little hook, release, and then everything can be nice and smooth.
Yeah. The one that I saw that was on your Avali hook was so strong. I mean, you couldn't even break it with your fingers from what I was seeing. And
Right.
I mean, that explains to me why the vacuum treatment didn't work. No
Right.
vacuum's going to be breaking those up.
Right. Yeah, exactly. Yep. You got it.
I mean, the before and afters are legit. There is no denying that this is a huge improvement.
Hmm.
And you know how sometimes you can see before and afters is like, well, they're in a different light. Well, really, they look
Hmm.
like you filtered it.
Hmm.
So I'm the biggest skeptic now, having been through numerous treatments, but also now the biggest believer. So I'm so excited.
Yay. I think is important to point out is we're only releasing the bands causing a problem. We're able to use that little hook to verify that we actually got them and then leaving all the structural support around it alone. So there was some research that they got to kind of piggyback off of and kind of figure out what's worked well in the past and what didn't work well with that.
Okay. And that risk that you're talking about is if we release too many bands, then we might have saggy skin more
Mhm.
so than we might. How do you know not like where to stop in terms of cutting the bands?
Yeah, and that's where the marking is so important.
Mhm.
And also differentiating between loose skin and cellulite, right? So when I'm, say I'm consulting a woman in the treatment room, we're literally going to be in front of the mirror together. I'm literally pulling up on the skin, kind of explaining the difference. So if I pull up on the skin gently and the dimple completely goes away, then it's naturally just loose skin, right? If you're over the age of 30, you have some loose skin on your body and you understand if you pull up, it looks smoother, right? Our knees, for example. Now, if it's true cellulite tethered by those fibrous bands, if I gently pull up, it's still going to be there. And that's how you know the difference. And I would say, especially in today's landscape of so many women losing weight, whether on GLP-1 medications or, in any other form or fashion, I see a lot of skin laxity. So that's where it is important to find a provider that's experienced, that knows the difference, is going to explain to you, what treats what. And then it all falls back on your markings. You're not releasing anything outside of your markings. You're only releasing right underneath that cellulite dimple. And I know because I treat cellulite, but I'll explain to you, there's so much structural support and fibrous bands underneath the skin that we just have to leave everything else alone. As long as you're only releasing, underneath that little dimple, then you should be good.
Okay, great. And is it approved for the booty, the thighs, the arms, anywhere on the body, or just certain areas?
Definitely the butt and thighs.
Okay.
I'll tell you when patients, and I do sometimes have patients come in saying they have cellulite in their arms or their abdomen. And I would say the chance of that is honestly very, very, very slim. It's almost always just loose skin. So it's
Mhm.
very, very rare that we would use Ovally to release or treat something in like the arms or the abdomen or something like that. It's
Okay.
almost always, because we're so lucky as women, that cellulite is almost always in the butt and the back of the thighs, sometimes the sides of the thighs. Very rarely, I will sometimes have it on the front of the thighs where I will release a little bit. But even on the front of the thighs, we're built totally different. It's almost always loose skin there. Now, we do a 360 treatment where we're often tightening all the way around the thighs, but typically on the front side, we're doing skin tightening versus cellulite release.
Okay, great. Um, Fantastic. And now I just thought of, the investment. What's the appropriate way to charge? Like by band that you release or the area or the time or what should a beauty seeker expect in terms of how someone might charge?
Great question. And everyone's different. Since we train on this, I get to work with a lot of different providers, and everyone does charge differently. Obviously, it totally depends on the practice. At APS, we've kind of just settled on a flat fee for our time. So because I don't, in the past, for other treatments, there have been different pricing for like this many dimples or it increases for more. I don't want you to have to decide what you're treating because of like a financial reason. Does that make sense?
Yeah, it
So
does.
if you're coming in for cellulite treatment at our practice, it's just a flat fee and I'll treat all of the dimples that we can find within that, procedure. And
Oh,
for us, that's worked really well. Some people it's faster, some people it takes longer, but it all kind of comes out in the wash. And our, most important goal is just that everyone gets a good outcome.
beauty seekers, here's what to remember. According to the Cleveland Clinic, creams and wraps can't get rid of cellulite. And according to Dermatology Times, the one injection that tried to dissolve the septi bands that cause cellulite was pulled from the market because it actually arguably caused something worse, severe and sometimes permanent bruising. We now know that what finally works is releasing the septi bands, which are the cause of cellulite at the source. Beauty seekers, before you spend $1 on treatments like cellulite elimination, get educated from experts like Sarah Viebrock, national cellulite trainer at Austin Plastic Surgeon. Every Beauty Seek subscriber helps us to keep bringing aesthetic experts like Nurse Sarah directly to you. Sarah, tell me about a patient who came in thinking she needed one thing to tighten her body and eliminate cellulite, and you saw that she could actually benefit from maybe stacking treatments to get the best results. What was her story like?
So, most women have more than one thing going on. And let's just describe a particular patient I'm thinking of. She's been on a weight loss journey. She had lost about 20 pounds. So, not severe weight loss, but enough that she's seeing changes to her skin, right? Even though she lost that weight, that stubborn cellulite remained, and definitely was the reason that she came in. So I see this a lot. Women typically describe everything they don't like about their butt and thighs as cellulite. And it's my job to educate them on what is cellulite, what might be loose skin. Do we have some volume loss going on? Maybe a little volume excess. It's typically a combination of all of those. So for her, she did have true cellulite, which we treated with Ovally, in any other form or fashion. I see a lot of skin laxity. So that's where it is important to find a provider that's experienced, that knows the difference, is going to explain to you, what treats what. If we're trying to do non-surgical skin stacking, it's going to include a treatment plan of devices, maybe like SoftWave, maybe Aveva, maybe some injectable skin fertilizers or biostimulants, like I like to call them, AKA something like Sculptra. And that's what we did for her. We built this custom treatment plan, combined cellulite treatment with skin tightening, and she got an awesome outcome.
Great. Oh my gosh. And I can't wait to dig into this, but it makes it so evident that we as beauty seekers should be coming to someone like you who have had the years, and run the cycles of, gosh, how to put together an appropriate plan.
Absolutely. It is so important for many reasons. One, safety. You've got to make sure that you're not treating every little waviness to the skin as cellulite, because as we discussed before, if you over release, you can actually create problems.
Help us understand how you might evaluate and build different types of body sculpting plans that might stack treatments based on the many different types of bodies that you see each day. Let's walk through some real patients. A woman who her only complaint is dimples, no loose skin, no volume, just cellulite. On a scale of 1 to 10, how likely is it that just releasing the cellulite bands and nothing else would give her the results she came in for?
Honestly, high, 8 to 10. I mean, if she's got realistic expectations, then hopefully a 10 out of 10. That's always kind of, what it comes down to. But if she truly, her complaint is cellulite, and on evaluation, that's what I see as well. Maybe she's young, she's not lost weight, she's still got healthy skin. She just has some of that traditional cellulite caused by those fibrous bands creating those indentions. Then a procedure like Ovally, where we release her bands, is going to give her a great outcome. And she is an ideal patient for that.
Perfect. Very simple. Let's not overthink it, right?
Right. Right. Yeah.
Okay.
Send me that all day. Perfect.
Okay. Perfect. Love that.
If we only released her bands, chances of her being happy is probably less than 50%, right? Because we're really treating less than 50% of the problem. So, again, this is where the education comes in. We only released those deep dimples. I'm only treating those bands that do not improve when you kind of pull up on the skin. Now, say she's lost weight, she's got loose, wavy skin. That means, sure, some of the deeper dimples will remain, but when you're doing a treatment to your butt and thighs, you're never going to stare at your butt and thighs more. And so all she's going to see is that waviness that remains from that loose skin.
What would you do to treat the waviness, the loose skin?
That's where it kind of depends on who you're coming to see. So say you're coming to Austin Plastic Surgeon, we're looking for a non-surgical solution for skin tightening. And actually, this is probably these days 80 to 90% of my Ovally cases, I'm combining with something for skin tightening, because most of us have lost weight, been on a GLP-1, or are just naturally aging, right? So that is the big majority of my patients. And we have a couple different ways that we do that. So if we're looking for non-surgical skin tightening, I am going to likely start with a device like maybe SoftWave. SoftWave is ultrasound-based skin tightening. Another one of my favorites is something called Aveva. Aveva is a laser that does skin tightening and skin resurfacing using the Martini effect. If you haven't heard of that one, look it up. One of my new favorites for sure. And then say maybe she's got a little more laxity than minimal, right? Maybe we're getting to moderate and I need to stack something. We came up with a term called skin stacking or a collagen combo where I'm going to layer that device treatment like we just talked about. Another one that I love is called Quantum RF. So those are my top three, I would say. Now we're going to layer that device with, and we're doing the sandwich technique now, with a biostimulant. So not necessarily for volume. We're just talking about rebuilding your collagen and elastin. So one of my favorites is Sculptra or PLLA. Another option is Hyperdilute Radiesse or CAHA. Those are some terms that you might hear of. And we're literally stacking or sandwiching these two modalities to wake that skin up and force it to make fresh collagen and elastin. That's the only way that we're going to get skin tightening is by rebuilding your collagen and elastin. So it's not instant. And that's where the education comes in. I've got to set that expectation that these results are going to take 6 to 12 weeks for you to see, but you're going to be really happy that you treated that waviness in addition to those deep dimples if you're looking for an overall smooth appearance.
Okay, so ultrasound can tighten the skin. Drinking martinis can tighten the skin. I'm just teasing.
I know, right? Aveva's exciting. You got to look it up. It's a pretty cool technology. They focus the laser in this martini glass shape, but the martini effect, it's cool.
I love it. Okay, I'm going to dig into that. But the rest of what you were talking about are actually injections. So your skin kind of heals itself.
Right.
That's what I'm
right. Yeah, exactly. And that's how I describe these skin tightening devices as well. We're basically creating a controlled injury to the tissue. You know, we stop making collagen in our 20s, right? So if we don't do something to wake up the skin and force it to heal itself and make fresh collagen, then we will have no fresh collagen, right? So we're doing that by, creating this kind of controlled injury to the tissue, whether we're using a device, an injectable biostimulant, wake up those cells that make collagen again so that we can get that youthful appearance back to our skin.
Wow. In our 20s. You stopped me at 20s. We're okay.
I know. Every year it declines.
Oh my goodness. Yes, I asked, one of the surgeons that I interviewed the other day about collagen. I said, what about collagen supplements? And she's like, well, you can if you want.
That's what I say. I'm like, it's not going to hurt anything.
Yeah.
Not likely going to tighten it, but it's definitely not going to hurt anything.
Okay. That makes sense here. Okay. Here's another. A woman with dimples, but also hip dips where the sides of her buttocks are, I don't know if this is the right word, like kind of caved in. How much of her result is really about smoothing the cellulite?
Yeah, I mean, so say her two main concerns are cellulite and hip dips. I mean, if we only treated the cellulite, she's going to be maybe 50% happy, right? That we're only treating half of the problem. If she really wants to improve that hourglass shape or the overall shape of her booty. Now, I will say, and we haven't even touched on this yet, which is an exciting part. If you release the fibrous bands that are actually flattening the butt, you can see an improvement to the roundness of the booty when we're talking projection from the side. Now, it's not a BBL, it's nothing crazy, but it actually can affect the shape. But it's very rare that we have cellulite that we're releasing in those hip dips. So in that case, we typically need to replace some volume. And one of my favorite ways to do that is with aloe clay. This is an injectable processed donor fat that can be done technically at the same time as your ovule, typically, depending on the patient, so that we're releasing those fibrous bands and then adding volume to those hip dips to give you a smooth booty, but also that hourglass shape that you've always wanted.
Okay. So you're injecting fat into the hip dips.
Yep, exactly.
And we talked about aloe clay. And is that if someone doesn't have their own, I've heard of getting fat from your belly and putting that in your booty, but if they've just lost a ton of weight, they don't have fat. Is that correct?
Right. So that is one of the most common patients that's using aloe clay is someone who's maybe lost a lot of weight, doesn't have fat to transfer. But another common patient that we see using aloe clay is just someone who doesn't want to have surgery or doesn't want the downtime With traditional fat transfer, you actually have to stay off your butt and hip dips for 6 weeks. With AlloClay, we let our patients sit right away. That fat is already processed and stabilized. So for patients who don't want to deal with anesthesia, they want to be able to get back to work the very next day, they want extremely minimal downtime, but also a nice outcome, then it's a really great option for them. Now, I want to be really clear though, AlloClay is typically not replacing a BBL. I'm never telling patients, hey, you're going to come in here for an awake procedure and leave with a Kim K booty, right? That would take a ton of volume. So I'm really big on setting realistic expectations, but that patient you were describing that's got cellulite and hip dips that she doesn't like, this is perfect for that.
Wow, that's amazing. And can you go over again why can they leave and just sit on their booty with Aloclay versus, alternatives?
Yeah. So, say we were doing a traditional fat transfer, which of course that would be with one of our plastic surgeons, where they're doing liposuction from an area of the body and then immediately transferring that fat to your butt or hips. In that case, that fat has not been processed and stabilized and gone through this rigorous process that Tiger Aesthetics does for Alloclay, which makes it shelf stable. It's not relying on your body to keep it alive or to help it remain, right? If I'm taking, and again, it wouldn't be me. If our plastic surgeons are taking fat out of your abdomen and putting it in your butt and thighs, that is relying on blood supply. It's got to be maintained by your body. And it's also got a lot of liquid and, volume that will be absorbed. So we've got to treat it like a baby. We try to stay off of it as much as possible for the first 6 weeks. So that can be a really gorgeous result because you are liposculpting, you're getting that subtraction of the waist and love handles, and then adding to the booty and hips. But not everyone wants that downtime. So sometimes if you're looking for a really minimal downtime procedure, then this might be a better option.
Yeah, that sounds like a great option. What about longevity with the Aloclay versus the traditional fat transfer?
Great question, hitting me with the hard one, Sam. So, I know we discussed this with Ovally, and when it comes to longevity, the answer is the same. I have to give you kind of the correct answer. We can only tell you that it lasts as long as the product has been out and been studied. We at Austin Plastic Surgeon were lucky to be a part of one of the initial clinical studies for the product. And we have patients almost 2 years out that we are following longevity. And we actually are seeing between 80 and 90% retention. And what we've seen over time is once their swelling goes down, which is pretty quick, between 2 and 4 weeks, depending on if they ended up with any bruising, maybe, we actually see that result stay pretty stable from that point. It's not diminishing. It's not going down over time. And we also are seeing, if you are comparing a before and after from maybe their 2 to 4 week point, especially definitely from their 6 week point to their 2 year point, we're seeing basically the same outcome. So again, you can kind of take what you get from that. I can't promise that anything is permanent, of course, but we're seeing really good long lasting results from this product. It's very, very exciting.
I love that. And honestly, it's comforting to hear you say, hey, we may not know, there's some unknowns versus
Right.
everything is,
Oh, yeah. Yeah.
Mhm.
And you've got to be transparent. You got to be clear. So this is the info we have so far. And I was interested to see how the patients would be excited for Alloclay, if they would be hesitant. We can't keep it on the shelf. We have patients flying from all over the country for it, or excuse me, all over the world even. So, it's a really, really exciting product. And typically it's, a patient that's been searching for a specific concern, right? And they finally found the specific solution for that concern. So it's amazing.
That's great. Wow. Austin Plastic Surgeon, you guys are way ahead. Way ahead.
Thanks to Dr. Franco. He stays at the cutting edge. I definitely have to give him the credit for that.
That's great. Great. Okay, you're in a like a growing learning environment. I love that. Oh,
Absolutely.
okay, the opposite problem. A woman with maybe a banana roll, if that's the appropriate word,
Hmm.
under her
Yeah.
buttocks or some fullness in her central body that she just can't stand. How much of fixing that is about adding volume? Would you ever add volume? I've heard that to kind of like, kind of even everything out.
Hmm. Yeah, yeah, good question. And I do hear, or excuse me, I do see that commonly where, obviously there's areas where we may want to add volume, like the hip dips, but there's also areas where we may want to take away volume, like the banana roll, or some people refer to that central booty area as a chicken butt, where it's like, and women that have it, they know exactly what I'm talking about because they will come in and describe it in that way. So I know these are kind of funny slang terms, but it's just areas of the butt and thighs where we've got fat accumulations that we cannot get rid of. So,
Mhm.
sure, adding to your hip dips is going to change the illusion of how your butt looks because we're creating this sweetheart shape, right? But typically it's about the addition and the subtraction. So, in an ideal world, we are removing a little bit of volume. One of my favorite ways to do that non-surgically is actually with some deeper RF microneedling. Some of the most common companies that do this are Morpheus, Vivace. That is a device that's used really commonly all across the country for skin tightening and collagen stimulation. But this is where you do, again, need to be really careful that you're going to an experienced provider. If they're doing RF microneedling too deep in your butt, you can actually lose fat. And that is typically not what we want. Now, in this case, though, we do because we're talking about the banana roll, right? For example, that's the easiest kind of area to imagine. So, in that case, that's the only area where I would be okay treating a little bit deeper with radio frequency microneedling and actually killing some of those fat cells so that over that healing time frame of about 6 to 12 weeks, your body will absorb those dead fat cells as waste and you will see that just kind of flatten out. It can take a couple treatments, right? It's not a magic wand. It's not liposuction. We're talking about a non-surgical solution, but I have created some really beautiful results by reducing a little volume that way, adding volume where we've lost some, and then smoothing that skin with maybe some cellulite and skin tightening, cellulite treatment and skin tightening.
Okay. Is there anything that you could do that would then counter the effects of that treatment? Like I was interviewing a plastic surgeon the other day, and the woman who was in charge of all of the non-surgical procedures would just, was very clear. Do not go out and work out after you have your facial. It will just counter the effects and you'll be wasting your money. Or here is it like, it really doesn't matter. You can, unless maybe eating a
Yeah,
donut.
yeah, I mean, right. You don't want to do something that's going to cause you to gain a ton of weight because then you won't be able to see any difference that we're making, right? But yeah, I mean, I as with anything, I'm going to have you avoid working out for a certain time period depending on which procedure we did, and that's just so that we're not increasing inflammation or, increasing risk of infection with sweat and stuff like that. But after a day or two, if we were just doing an RF microneedling procedure, you can get right back to anything. And it's not going to counter that effect at all.
Okay, last one, and it's everywhere right now. According to the American Society of Plastic Surgeons, body contouring procedures after major weight loss have surged with the rise of GLP-1 medications like Ozempic. So, a woman who's lost a lot of weight still has cellulite, but now also has loose skin and lost volume all at once. I'm just going to hand it over to you. How would you evaluate and what might your stacking procedures be?
Oh, yes, the dreaded Ozempic booty or Ozempic butt. This is what we see all the time. I mean, very, very commonly, we have a pretty high volume of weight loss patients in our practice. And if they're not losing weight with us, then they likely are getting those medications somewhere. We know they are everywhere right now. And if they have lost a substantial amount of weight, then they absolutely are going to see those changes in their butt and thighs. So this is where creating that custom treatment plan really comes in, to create a great outcome. So we've got to treat all of the different concerns with a different modality so that everything is being treated appropriately, right? We're going to treat her cellulite with Ovally. We're going to get rid of those fibrous bands because if I don't do that, if I just do everything else, she would still have those deep dimples, right? We're going to pair that with something to tighten the skin, maybe some of our skin stacking or structural sandwich procedures that we discussed earlier. We're going to replace lost volume with something like aloe clay. Oftentimes I can do these together, or it might be a staged treatment that we need to do over a couple months up to a year, and maybe even financially, if you want to break these procedures up, we absolutely can do that too. Sometimes I'm building out a year-long treatment plan, just like we might do for your face for your button thighs, right? So as long as we're addressing whatever concerns you have based on, say, this particular patient's lost weight, she's got cellulite, she's got, loose skin, she's got volume loss, and we're creating a treatment plan for each of those concerns, then she can get a really great outcome non-surgically. And it's super exciting. Now, I'll still say, because I work for some fantastic plastic surgeons, if they have lost a substantial amount of weight, that's where it is so great when you do work so closely with plastic surgeons, because sometimes, and I'll be the first to tell you, don't waste your money on non-surgical options if it's not going to give you the best outcome. Sometimes surgery is the best outcome. And that's where, again, making sure that you're going to a provider that can give you the right treatment plan so that you can get the best before and after that you can.
In what instance would you kind of make that suggestion to, gosh, I'm going to refer you to a surgeon?
It's hard to say, an exact amount, but if someone, because, depending on their frame, right? Like I actually lost 40 pounds on GLP-1 medications. But 40 pounds on me, I'm 5'6", looks a lot different than like someone that's shorter, or depending on how quickly they lost it, right?
Mhm.
Depending on the quality of their skin. So everyone is different. We really do have to evaluate them in person to know, hey, this is absolutely something that I can treat non-surgically, or would you be happy with this type of before and after? But if it's someone who their skin is literally kind of hanging over the top of their booty, they've got that like kind of crease from the skin hanging over, then we know there's someone who's probably going to need some type of butt lift or body lift. And that's where, I'm going to be the first to tell you, don't waste your money on something non-surgically. Or like, hey, maybe you have cellulite and we do need to treat it with Ovally before, Dr. Franco or one of our other surgeons does some fat transfer or a butt lift, right? So sometimes it's a combination of non-surgical and surgical outcomes, but that's where you just want to make sure that we are creating that custom treatment plan based on your specific body to get you the best outcome.
I love that. It makes sense just to step back because we all want it to happen so quickly, and we
Right.
might jump into a treatment. Yeah, that treatment might not have
Isn't the
been.
right one. Hmm.
Yeah. Oh my goodness. So, Sarah, you spent this whole conversation just taking the blame off women, and I love that. What is it that keeps you doing this, patient after patient?
It's all about the confidence. So, as we mentioned before, I love doing cellulite treatments because it affects all of us so deeply. It's something that, has probably driven us crazy for years. And if something is affecting your confidence, then it affects every part of your life. It's almost like losing weight. When you've lost weight and you've got this new confidence, then every part of your life shines, right? Like you feel better at work, you feel better in social situations. The same goes for doing cellulite treatments or really any aesthetic procedure where I'm improving something that bothers you. If you've got that newfound confidence, then you're going to be confident in every part of your life and just happier overall. So definitely it's my patients and the fact that they've got this new confidence that shines in every part of their life. So if we've, solved the problem that has driven you crazy for years, likely you're feeling fantastic. You're, at Pilates in your tight workout pants, maybe a light color, which you never felt confident wearing before, right? That confidence is going to soar. And that's the best part of my job.
Right. Yes. If I can wear pink leggings, that would be great.
Right? Yeah, exactly.
Okay, beauty seekers, here's what to remember. Now you can minimize the look of cellulite by releasing the septi bands that cause your dimples. It's very rare that there's a single treatment that fixes all of our body sculpting desires. To treat multiple body sculpting needs, you should visit a professional like Nurse Sarah to tighten loose skin, pull volume back where you've lost it, and or reduce where you don't want it. The smoothest, most sculpted results come from a plan built for you by a professional like a registered nurse like Sarah. Sarah, thank you. You showed us all that cellulite is never a woman's fault and that it can finally be treated. You are a gift to the Beauty Seek community.
Thank you so much, Sam. Thank you for having me. Thank you for helping raise awareness around this topic that means so much to me, but also I know affects, as we said, over 90% of women. So I could not be happier to be here.
Great. Yeah. And I would love to come back and talk about what was it? What was the topic that, oh, the martini.
I know the martini effect of Ava coming up next. That's one of my favorites. You can actually use it head to toe. So let's do it.
Okay, perfect. Great. Let's do it. Beauty seekers, if you want honest, evidence based answers about treatments like cellulite, straight from experts like National Cellulite trainer Sarah Viebrock at Austin Plastic Surgeon, subscribe to Beauty Seek so you never book a treatment blind again.